We're now looking at contraindications and modifications, and we're going to start off with ones that would prevent. We are now looking at deep vein thrombosis, pregnancy and chemotherapy, all of which would stop you from doing a treatment. Please know that yes, you can get a massage when pregnant, but it needs to be over a certain amount of months, which is advisory of 3 to 4 months. And they need to go and get a pregnancy massage, which is done by a specialist. Chemo, you should not be doing anyone who's going through chemo. When you are massaging, you're stimulating the blood cells, which will move any cancer that they have around their body. So we need to avoid. And again, with deep vein thrombosis, you need to make sure that you avoid so you don't block the arteries, as it's all to do with your circulation. We then are going on to acute rheumatism. This can be very painful, so you'd avoid massage. We'll then move down to alcohol. Anyone who's drinking alcohol is a no-go. Sometimes you're not going to know, but you generally can smell it. That's going to cause them to faint. And then we've got impetigo, a skin condition that's very contagious. You're always spreading it to client or to yourself, or even around the rest of the body. We've got ringworm and scabies, both which are very contagious and you would avoid. You don't want to be giving your clients or giving yourself that, or as well as spreading it onto your client. The next one is respiratory infection. Again, if you're doing massage, you can then spread this. Then we've got phlebitis, which is inflammation of the veins, and this can be very painful, so I would avoid. So we've also got recent operations and heart condition. Recent operations should be at least after 6 months, and any heart condition, I'd always get a GP letter. Always be cautious with anyone who has a heart condition. Now, modifications, you can still do a massage, but you just need to work around the area and adapt your massage to suit this client. When we're looking at varicose veins, we need to make sure that we're not going over them. You can pop them, you can bruise them, so just avoid that area. When we're looking at epilepsy, we need to make sure that we are, again, cautious. We can actually cause an epileptic fit. So again, GP letter, and making sure that you're taking things a lot more slower. Product allergy. You will always be doing a patch test. Always check for any ingredients that may react with your client. If they mention anything to you, always again double check that it hasn't got the ingredient in there, and always choose an alternative. Something vegetable oil is quite a good one to use because it hasn't got nuts, and normally people are okay with vegetable oil with the odd exception. We are then looking at certain medication. Again, we are not doctors. We don't expect to know everything. So if you don't know it, there's no harm in telling your client that you need to go and check. And if you still don't know, then there's no problem asking for a doctor's note. Please make sure if you don't know medication and you don't feel comfortable doing it, don't carry it out. But there is certain medication you do need to be careful of. You've got high and low blood pressure. This is generally to do with your heart. So just make sure again you're getting a doctor's note or double checking that it's all okay. You don't want to be stimulating that could cause a negative effect. So anyone with any minor cuts or eczema or any skin conditions, you can still carry out a massage. You would just avoid that area. If it isn't weeping and it isn't bloody or scabby or anything like that, you can go over the area if it's very minor. But yes, just leave that area out, don't touch it and don't irritate it, let it heal. And you'll just explain to your client as the reasons why. With fractures and undiagnosed lumps and swelling, I would just avoid that area. Can you please be careful with lumps and swelling though, as you don't know if it could be cancerous, and you don't want to again be stimulating the blood and maybe causing that to flow around the rest of your body. So I would generally say any bumps and lumps that don't look too, if they've caught it when they fell over or anything like that, yes, proceed with the treatment. Or if you're not quite sure where it's come from, make sure that you get a doctor's note. So any contraindications, you're always going to find out during consultation. Make sure you write everything down, discuss anything, and anything you're not comfortable with, always go and get a doctor's note. Please remember that you cannot ever diagnose. You never tell anyone if they have something. You can only advise.